COVID-19 cases in the country continue to decline, but the COVID-related deaths remain at around 100. To discuss this, we have with us this morning OCTA Research Fellow, Guido David. Professor Guido David is joining us via Zoom. Professor, magandang umaga. Good morning.
Hi, good morning, Ariza.
Sir, can you explain to us why do deaths remain relatively high despite the drop in cases?
Right. Well, what we know is that there is usually a lag or a delay from the time of onset of COVID to the time of deaths. So that time gap is usually around 2 to 3 weeks. Sometimes it's longer because sometimes there are deaths which are reported late. For example, deaths outside hospitals are usually reported comparatively late. In fact, sometimes we still have cases wherein deaths are reported for last year, but they're just reported recently. So for COVID, and what I have to say about that is most of the deaths are happening outside the NCR, particularly in provinces where vaccination levels are still not as high as in the NCRs, because actually the death rate in the NCR is fairly low right now.
Sir, given also the decline of cases, can we say that we are now safe, especially from the highly infectious Delta variant?
Well, the risk level is low actually now in the NCR and in many other regions around the NCR. And where the 7-day average in the NCR is 427. This is comparable to the average last year, the daily average in the NCR from November until February before the surge. So the risk level is low. That being said, the virus is still out there. So although we support the reopening of the economy because it's badly needed by the economy, we hope that people still follow and comply with the minimum public health standards of wearing face masks and following the 3 Cs because the virus is still out there. Some people are still getting sick, especially the unvaccinated, and especially, well, not especially, but this may include children who are unvaccinated. So although our restrictions have allowed mobility for children, especially those age 12 and below, we should still be mindful of these threats to our public health, and parents should take responsibility in their children if they're going to bring them to the malls or public places.
Very true. Sir, are there any new variants that we should look out for?
Yeah, we continuously monitor the variants all over the world. The biggest threat possibly is the AY4.2, which is a lineage of the Delta variant. So we could say that it's like a Delta plus. But right now, it's not that concerning based on findings from other countries. In fact, it's taken hold in probably in UK. We're not saying that it will not be a threat in the future. It might be, but right now we're not that concerned about it. And the other variants are not really concerning. They're comparatively weaker compared to the Delta variant.
Professor, going back to your advice earlier about, of course, parents taking, responsibility of their kids since they're going out more. There's a report about a 2-year-old boy that tested positive for COVID-19 after visiting a mall. Should this be a concern again for parents, and should LGUs, for that matter, reconsider easing the restrictions on children?
I think this should be a concern for parents, and I think the LGUs may discuss, at least or reconsider these restrictions on children because, as we mentioned, a lot of children are still unvaccinated. Now, when we say that we could move down to alert level 2 or even 1, and we support the reopening of the economy, it's not the same as saying that we're over the pandemic or that the virus is no longer a threat. The virus is still a threat, especially for the unvaccinated and the children. And that's why we must keep our messaging consistent that we are doing this because we want the economy to recover, but we're not doing this because the pandemic is over and everybody can go out and go back to the old normal. So that shouldn't be the case. Now, if cases decrease further to less than 1,000 per day by December, then we might be able to have kids go out again. But at this time, I think there's some concern about children getting sick, and this is what happened in other countries in the UK when they fully reopened. So this is something that could also happen to our country.
So I would like to get your invites about, or rather insights on that matter, on your thoughts perhaps on Boracay waiving their swab test requirements for visitors starting next week.
Well, I think they're depending on the risk level of the country right now. I mean, yeah, we have to agree that the risk level is low in most areas, possibly except for a few areas like Negros Oriental, where we're still seeing a significant level of risk. We consider it around high risk Negros Oriental, but in many other places the risk level is low. And we understand that the tourism sector wants to ease restrictions so that they can encourage more travelers, because that will amount to more businesses for the tourism industry, which has been badly affected over the past year. But I think there could be a balance between fully opening up and still having some level of safety. When we waive the requirement of testing, of course, we're saying that we're taking on the risk. Now, is the risk level low enough that we can assume that level of risk? I think at this time the risk level is low, but I'm not sure if it's that low. So maybe they could still consider having some form of test, like antigen test. But that being said, again, we understand that if they require more requirements, or like testing and even antigen testing, it might dissuade a lot of travelers, because RT-PCR and even antigen testing will cost money.
So how about for mandatory vaccination of workers on site? Are you in favor of that?
Well, I'm not a legal expert, so I may leave it up to the legal analysts if it's something that could be taken up. Personally, I believe in freedom of choice. I don't think we should be requiring things from our kababayans. But that being said, I also understand the perspective of requiring vaccinations, especially for certain sectors wherein public safety would be a concern. For example, I think it's required for most people working in restaurants and maybe hotels to get themselves vaccinated. There may be other sectors wherein it may not be absolutely necessary. So I think there's sort of a gray area here, and a wide range of possibilities or options depending on the type of workplace and the type of business establishment.
Professor Guido, one final issue. We've seen cities lift the mandatory use of face shields. Do you think the government should get on it also and lift the mandatory use of face shields?
Yeah, face shields is a very contentious issue right now. We understand the perspective on both sides. Last year, when it was first implemented, we supported the use of face shields, because especially when we have a surge, if the use of face shield adds even just a little bit of extra protection, let's say 1% extra or 2% extra, then that little bit of extra protection could help in a time of a pandemic or in time of a surge. But right now, when cases are decreasing and cases are fairly low in many places, I don't think that 1% or 2% will make a significant difference. So, but we will leave it up to the health experts to discuss with the local governments, which are already in the process of not requiring face shields in public areas. That being said, if they do not require face shields, we think that it's actually hinged on science that the extra protection right now is not necessary.
Professor, we'd like to thank you for sharing with us your time and your insights this morning. As always, maraming salamat. That's Professor Guido David of the OCTA Research Group.